So you'll notice that I made a punch cut that was about 1.5 millimeters in depth towards the facial or your facial extension. And the burr is then going to be reinserted into this small initial hole and then extended incisally and gingivally, making sure to leave a small shell of tooth structure along the proximal to protect hitting the adjacent tooth. We don't have to worry about going too deep axially if we leave about a 0.3 millimeter little shell on the side. There's plenty of room for the burr to fit and for us not to hit the adjacent tooth. The key here is to keep the position 90 degrees relative to the lingual wall and make small little brush strokes to remove tooth structure. This preparation really doesn't take more than about 2 or 3 minutes to do. It's pretty simple. Let's take a look as I spend some time performing some of the extensions. I think it was pretty clear in that little clip that we are really spinning the burr at a very low RPM in order to achieve extensions to the outline form. Refinement for the preparation is performed with a combination of the 10614 enamel hatchet, which is an amazing instrument, particularly if it's sharp like this one. And we're going to use this in this direction and upside down in order to get the proper refinement. You'll see that we can use this instrument in this particular way to chop away undermined enamel. And so the first thing we're going to do is we're going to take the instrument, insert it into the prep, and just click it over towards the proximal. You'll have no possibility of damaging the adjacent tooth with this particular method. And you're going to knock off that little shell, which is going to allow you to then insert the instrument perpendicular to that and remove any C-shapes or any undermined lips of enamel by just pushing it in this direction. So we can push it in here, remove that little area up near the incisal proximal, and then we can slide down along the facial wall. We're not trying to make sharp internal line angles. In fact, we're making rounded line angles, and the reason we need to do that, of course, is because composite needs to be adapted to a round internal form. And you can see that when we use the instrument in one direction by starting at the facial and scraping it out, or starting at the gingival and pushing it in, and not going from two different directions, we'll never create a sharp line angle. We'll always keep that nice and rounded. You do want to be careful not to scrape tooth number 9, and it's usually pretty easy not to do that, but you want to be a little bit mindful of that as you're moving along. This instrument is 1 millimeter wide, so our preparation needs to be a little deeper than 1 millimeter in order for us to have the instrument fit easily. So we've just spent a few seconds really performing a little bit of refinement. There are still some rough areas, some extra little marks along the outline form that need to be extended, and we're going to use the burr now for that. Very slowly, very carefully, just using it almost like it was a little sanding device that we're just going to feather strokes, little brush strokes, just to remove any little lips or irregular areas in the outline form. And this is where you need to take a lot of care to avoid hitting the adjacent tooth and avoid making a large preparation. So you can see at this point that it is nearly finished, and it didn't take very long at all. We can use the hand instrument again just to remove any little lips down here. We don't want to have that angle, that cable surface angle, to be acute. We want to have it 90 degrees or slightly obtuse so that the enamel rods are supported. When we take the tooth out of the type and I look at it from the side, you can see that it's almost like a box on a class 2, but it's dropping at 90 degrees relative to a class 2 box. It's sort of horizontal, and all the line angles should be rounded and clean. Do we need to put retention grooves? Well, there's a lot of controversy about that, but usually today most schools are not teaching retention grooves, nor are they teaching cable surface bevels. Leaving a butt joint margin like this is very acceptable. This is the RGS 1, which is showing you that the facial extension is definitely more than 1.5. Now let's look at the RGS 2, which is 2 millimeters. And there we have it. It's almost exactly 2 millimeters going towards the facial, your facial extension. Not your facial depth, but your facial extension. If we look at the RGS 4, which is 4 millimeters in length, we can see that the prep is about half of the buccal lingual dimension of the tooth. The RGS 4 is 1.5 millimeters in diameter, and so we can see that the axial depth in this particular case is less than 1.5, but with the RGS 3, which is 1 millimeter, we can see that it's more than 1 millimeter. So we're probably looking at it somewhere between 1.2 and 1.4 millimeters of axial depth. We can also use the RGS 2 length to determine the proper dimension incisal gingivally. If we look at the gingival clearance, you can see that it's a little bit less than an RGS 1. So it's about 0.3 millimeters of gingival clearance, and yet the incisal contact has remained intact. We haven't broken that. If we look at this from the facial view, you can see that it barely is visible from the facial. Just a little sliver of the preparation is visible, and it follows the contour of the adjacent tooth very nicely. So this is basically the